We started the Cutting Edge programme in 2010 because we recognised that there were quite a number of vets, often vets younger in their career, who really wanted to do emergency work, loved the thought of the sort of exciting caseload that we see, but maybe just didn't quite have the skills or confidence to make that transition from being a confident, albeit fairly young general practitioner, to doing sole charge emergency work.
For Cutting Edge, we're looking for vets that have a minimum of 6 months experience in small animal practice and have built up a broad range of skills in terms of consultation and also basic surgical skills. Once vets have gained those skills, we can then build on those through the course and the practical training to set them on their way to becoming an emergency vet.
I think it's very important to give young people support and guidance, and my impression of the course is it's a robust and comprehensive course that actually prepares them very well for the career that they're looking at.
The thing I enjoyed most about the Cutting Edge program is meeting all of the people who will be supporting me throughout the rest of my time as an ECC vet, and making really strong connections with them so that I know that I will be supported throughout my career.
What I will definitely take with me is how to communicate with clients. The language and cultural barrier can be overwhelming, so here we have been receiving tips on how we can communicate better.
The teachers have been great. They're all very approachable and down to earth, so we can just ask any questions that we have with them.
Cutting Edge has allowed me to be a bit more confident about my skills and my knowledge. I would say I'm a better vet, especially regarding patient care.
As a vet, if you complete the Cutting Edge programme, there's a few things that you will almost certainly receive, along with 322 hours of CPD training from a wealth of experienced vets within the emergency field. You'll develop practical skills to deal with surgical emergencies, ultrasound skills, diagnostic skills, consultation skills, but more importantly, you'll make so many friends along the way. You'll have a solid base of support to carry you on through your career with Vets Now.
I love doing this teaching because I'm taking, if you like, raw recruits who are not used to exotic patients, and we're teaching them some real practical things that they won't have been taught in university, they won't have picked up from textbooks, but things that will help them in their day-to-day clinic life with exotic patients. So it makes the quality of working life better for the clinician. They feel better prepared and ready to cope with things they haven't coped with before. But from a patient point of view, it is obviously vastly better.
Emergency medicine is such a rewarding career choice. My advice would be, if you're looking for a little bit of excitement and a challenge, emergency medicine is the place to be. It covers a breadth of specialties from cardiology, surgery, internal medicine, diagnostic imaging, and beyond.
I'm so proud to work for Vets Now because it's a business that genuinely puts the people who work for it, and also the patients right at the centre of the business, and knows that our success as a business is all about looking after our people, and by looking after them, allowing them to look after patients.